Hemorrhoids. Now this is a condition nobody wants. It's embarrassing. You don't want to see your doctor. You don't want anybody to look down there. You just want them to go away. Hello, I'm Dr. Luke, and I'm going to help you understand what hemorrhoids are, why they are there, to know if they are dangerous or not. Can they be cancer? Can you treat them at home? When do you need to go see your doctor? Firstly, let's look at the different types of hemorrhoids. Hemorrhoids are blood vessels around the anal area that when they swell up and they get enlarged, they can cause discomfort. They can cause burning, they can cause itchiness, and yes, they can even cause pain. The two main types of hemorrhoids are the internal hemorrhoids and the external hemorrhoids. The external hemorrhoids are very sensitive, and if they develop, they can really cause a lot of pain. Internal hemorrhoids have different degrees. You get a grade 1, a grade 2, and a grade 3, and a grade 4 hemorrhoid. Grade 1 hemorrhoids are mostly on the inside. You don't feel them, they can bleed, but they just slightly enlarge. Through grade 2 and grade 3, they get bigger. A grade 4 hemorrhoid is a hemorrhoid that is always on the outside, and it protrudes and you can feel them. The external hemorrhoids are, as it says, external, and yes, they can sometimes cause a big complication called thrombosis or a blood clot. If a hemorrhoid makes a blood clot, it is really, really painful, and it sometimes needs to be drained, surgically drained by your doctor, but you can also use some home remedies for it to resolve and to get rid of the pain. So, what are the main causes of hemorrhoids? Constipation, pregnancy, obesity, heavy lifting. How can we treat hemorrhoids? The number one thing is to have a high fiber diet. Fiber and fruits are really important. So if you have a high fiber diet, which is going to help to avoid constipation, and healthy eating food, not a lot of junk food and gassy soda drinks and all those things, that will really help. Secondly, when you develop the hemorrhoid, Sitz baths might be an interesting term that some people don't know, but Sitz bath is a device that you get that you can put on top of the toilet. You can put water in it, as you will see on the picture, and you can sit on that and soak the hemorrhoids in the lukewarm water. It's also a good idea to add Epsom salt to the water. That is very concentrated, and that's going to shrink it and going to make the swelling go down, which is definitely going to relieve the pain. We also get creams and suppository that you can use. The cream and the suppositories contain two main ingredients: a local anaesthetic agent to help with the pain, and a steroid, which is anti-inflammatory to help with the swelling and to help heal it. Because of the steroids, some of them are actually on prescription, and you might need a prescription from your doctor, but those are the two mainstay treatments for the hemorrhoids. One very important thing to remember is a cut-off age, and that is 35. Recommended by surgeons. If you're younger than 35, you can treat the hemorrhoids, and if it doesn't go away, yes, maybe go see your doctor. However, if you are older than 35, it is very important to commit that after your treatment and after it's resolved the acute phase of the bleeding, that you do go see your doctor and get an examination done and plan to have a colonoscopy. You get other conditions that are more serious that can cause bleeding as well. Conditions like rectal cancer, colon cancer, polyps, ulcerative colitis, and Crohn's disease. So it's really important to make sure that you don't end up getting treatment for recurrent rectal bleeding over 1 year, 2 years of time, and then eventually get an examination and you might have a serious condition that could have been treated because this is such an important condition to diagnose properly and to treat properly, I would encourage you to like the video and click on the subscribe button so that we can spread the word and more people can actually learn about this. People that don't have access to doctors always, but have access to a smartphone or to the internet, to know what it is and to know for themselves when to manage this at home and when the danger signs are there, so that they can actually get referred and see someone. It's a pleasure talking to you, and remember that because of a lack of knowledge, people perish. So, as always, stay healthy.